First of all, we can't forget that we live in a very complex ecosystem today that is not particularly favorable. The issues in the world are messy. The economies in the world are messy. Certainly the European economy and the survivability of the euro is an interesting question. I was at a major economic forum at Lago di Como last weekend, the Ambrosetti Forum, where they had all of the leaders of Europe together to try and figure out whether we're actually going to be able to solve this problem. I would tell you that the speakers were highly pessimistic, but in the end, when they asked a poll of how many thought the euro would survive in 5 years, everybody said yes. So notwithstanding the kind of harsh reality that the people and the politicians may not be very well connected, there is confidence, at least among those people, that the euro will survive. And you can certainly see that the capital markets, US, Europe, and others, are reacting favorably. So there is a belief today, I think, among the politicians and maybe some of the financiers that the euro will survive, notwithstanding, I think, a lot of skepticism among the people. But as you know, we have major economies in Europe that are in deep yogurt, particularly the southern European economies. And we have this kind of artificial thing called the euro in between, the northern economies, which are rich and strong, and the southern economies that aren't, is causing, I think, some tension. We're not done with that. We go up and down, kind of like the weather, whether the euro will survive. But it does have a lot to do with capital and capital markets, and we certainly live in a world in which those capital markets are fundamental to our industry. We have been driven in this industry for the 45 years I've been doing this by access to capital. So I'm not concerned about capital just because I'm a finance kind of guy. I'm concerned about capital because it is the fuel and the lifeblood of this industry. And I think we have to recognize that it is a tougher market today than it's ever been. Second thing to recognize is that the impact of this more austere world that we have is that governments are trying to get more for less. And you can look across all of the governments around the world, not just the European community, but governments around the world who are trying to basically improve outcomes at lower cost. Now, we're not necessarily driving efficiency into that system, yet we may have to. And so the unfortunate state of where we are is that by and large, the tests historically have been, can we develop products that are safe and efficacious? And whether we like it or not, the third standard of pharmacoeconomic efficiency is real, and the products that come into the market tomorrow not only have to be safe and efficacious, but they're going to have to improve healthcare and lower cost. We may not like that, you may not see that written in the official regulatory rules, but we're clearly going to live in a world in which economics plays a major role in what we get approved and we bring to market. There is no doubt that the debt crisis that we have are directly affecting our customers. As you know, most of the customers across Europe are governments. They are the provider and payer for most of the healthcare. Most of those are looking for dramatic savings, and we can see company by company worse results than we would like because of the more austere world that we are in today. And so we get to this situation where governments are demanding more for their money. And interesting, as an American, I can tell you that the rules on pharmacoeconomic efficiency are not being written by the Americans, but are written by you Europeans. NICE in the UK, AMAG in Germany, other institutions in Europe are already saying to the product-based companies, you prove to us that your products improve outcomes and reduce costs, and we will risk share with you. We will give you the benefit of some of those savings. But those rules are going to affect this industry globally, and fortunately or unfortunately, they're being written here in Europe. And so I think the strength of government-driven healthcare programs is driving change, which will be fundamental to the world of healthcare. And we need to recognize that we are moving from a fundamentally dysfunctional sickness care system based on cost to a system based on value. And don't underestimate the complexity of computing value, because value is different in the hands of every payer. To make a simple argument, some of you may or may not know of a company called Kaiser Permanente. It's the largest integrated healthcare system in the United States. It covers a third of the population in California, where I live, with a substantial amount of the U.S. population. If you go to recover your value or charge prices to somebody like Kaiser Permanente, it's entirely different if the payer is Aetna, or the payer is the French healthcare system, or the payer is the Chinese healthcare system. So value is a function of independent payers. So you can't sit in your office with a bunch of slick boards and prove what the value is of your technology and throw it over the wall and get that. You're going to have to prove value at each specific payer level. That's a humongous change from the world that we've been in. There are developments, both positive and negative, here in Europe. I don't need to inventory for you all the developments. Certainly EuropaBio and others are on the cusp of that. But I would say on the whole, we're a little bit positive from where we've been, not entirely. But courts around the world have added greater uncertainty on the IP side. If you took a snapshot to the past and said, are we better or worse on an IP side, we're probably worse as an industry. If you ask me what do we need to do to get more IP protection, I would tell you complexity is our friend. The more complex it is, the higher degree of protection you're going to have. If all you're doing is cloning a gene, you probably won't have a lot of protection. So whether it's good news or bad news to you, complexity is our friend. Healthcare reform, not only in the United States and elsewhere, is important. And I think it's important in some level to drop back for a minute, take a deep breath, and say, what are fundamentally the problems that we're trying to solve? Why are we in this business? Well, one reason we're in this business is that healthcare costs on a global basis are escalating dramatically. Why are healthcare costs going up? Is it because we're just bringing expensive technology to the market? No. The fundamental reason all of the countries in the world, including every country in Europe, has a challenge in healthcare is because we have, by and large, an aging population, and we can hook old Steve up to enough technology that death becomes optional. It's not economically efficient for every country to keep everybody alive. So healthcare costs are going up on a very, very dramatic basis. Now, all of you know here in Europe, we ration healthcare. We decide how much of the GDP we're going to spend on healthcare. That's fine. You may get whatever you want. You may die before your number comes up. So we ration healthcare by managing the supply. But by and large, we're moving from a system that is payer driven to one that will increasingly be patient or user driven. And so the practice of medicine is going to change more in the next 10 years than it has in the last 1,000 years. I think I mentioned when I was here a year ago that the healthcare system fundamentally hasn't changed for 1,000 or 2,000 years. So if you think about this healthcare system 2,000 years ago, what was it? You waited till you got sick, you went to some form of healer, they tried to do something, most things didn't work, and you died. Today, if you look at our healthcare system 1,000 years later, it's not very different. It's basically episodic. That is to say, we wait for a healthcare episode to happen. We call that sickness. You go to the doctor, the hospital, the nurse. They try and do things. And quite frankly, most things don't work. Now, we've got better technology. We can diagnose things. We've got lots of technology to help you live forever. So we've converted all of the acute care costs that we used to have to chronic care. 76% of our cost of healthcare today is keeping people alive. And so we're going to see more change in the system in the next 10 years than we've ever seen before. And so what do healthcare systems want? Healthcare systems basically want better access, lower cost, and improved outcomes. And we have to accept that in this industry, if we're going to succeed in the industries that we're in, we're going to have to improve access, that is to say, have things that everybody can use. We're going to have to reduce the cost burden, and we do have to improve the outcomes. That's a lot different than just safety and efficacy. And so I'm going to talk a lot about what's really ailing this healthcare world. Healthcare is an interesting word because we don't have a healthcare world. We have a sickness care system, and in fact, it's a fairly dysfunctional sickness care system. The hope we all have is that we, in the next few years, can move to a truly healthcare-oriented world, a system that is treating a well population preemptively rather than a sick population dysfunctionally. Again, don't misunderstand the consequences of doing that. In the United States today, we spend about 20% of our GDP on healthcare. Those people aren't going to move off the island quickly. There's enormously perverse incentives to keep doing what you're doing because a major hunk of our economy is doing it. The same is true in Europe. The same is true in most countries. And so we're beset with an aging population, the rise of chronic disease, lots of new technology coming into the system. We're focused on basically treating, in most cases, the symptoms of disease rather than the course of disease. And more importantly now, whether we like it or not, we're moving from a system around the world that's been based on cost and cost reimbursement to one that's truly based on value. Now, in the past, if I was doing clinical development, what would I do? I would try and define the smallest possible population I could to prove that my technology was safe and effective. And then I would throw it over the wall to a highly variable patient population. So we live in a world today of essentially one-size-fits-all drugs. But we know that whether it's drugs or biologics or products, we as a population are incredibly variable. So it's no surprise then that the y-axis happened because we've had a one-size-fits-all world against a world of really more customized or personalized medicine. So we're moving to a very different world. And we're doing that because technology is transforming what happens at the patient level, what happens at the provider level, what happens at the payer level. And technology is very, very real and very much into the world of today. But if you look at healthcare today, actually most things don't work. 55% of the drugs we use don't work for the patients that they're prescribed for. If you look at something like cancer, 75% of the things we do in cancer doesn't work. 50% in most areas of what we do doesn't work. Now think of the massive cost at a societal level of doing things that don't work. And by and large, we have a trial and error system. So we're moving today to this world of kind of modern technology driven off enormous amounts of information. Genomic information, proteomic information, even things as simple as electronic health records where we've got a little bit of information about who we are and what we've done. And so the practice of medicine is moving essentially from the treatment of symptoms to understanding the mechanism of disease and actually beginning to treat the disease. And then not to treat my disease and Natalie's disease as if we're the same, but to recognize that her form of cancer and my form of cancer are different. We may have the same terminology, but we fundamentally have different diseases. And so we're beginning as society to truly understand that variability in patients and then moving very quickly to customized medicine. And if you say, what really does that mean? It means that we're moving from a system that was designed around the world to treat really sick people acutely to a system around the world today that's treating people chronically, keeping most people alive. We're moving from basically treating a system of really sick patients in hospitals to where we today are using technology that can transform the place of where technology is. So I think I showed some of you last year. I'll stand up and do this for the sake of, so I can take my iPhone, just like your iPhone, and I can show you my EKG live right through my shirt. So we have technology today that's coming that will change the nature of place. If you're on the board of a hospital, you ought to think pretty hard about what that hospital is going to look like in a few years when you have technology that can take cardiovascular patients. We have 3 versions of this, by the way. We have a pad you can put your hands on, and we have a smart Band-Aid so we can get 24/7 monitoring. We do have CE mark approval for this, and we'll roll this out in Europe starting October 1. We'll roll this out in the US starting January 1. This is transformative to cardiovascular health. But we have the same technology that can deal with glucose for diabetics. We have the same technology that can provide ultrasounds. And so we're moving to a world where the consumer is armed with technology. By the way, I could give this to you free because it isn't your use of the technology, it's a read that the cardiologist does wherever they are in the world, where the academics are. So we're moving from place, home, hospitals I should say, to home for the aged, and to people like you and I who will go in, have surgery, go home, and you'll have real-time monitoring on a present basis. That's a massive change in the system that we live in. And while we don't, in many cases, understand the consequences of that change, the payers do. And so the payers, whether that's the government healthcare systems in various countries, whether it's your employer or whether it's an insurance company, the payers understand fundamentally that we can improve outcomes at lower cost using this technology, using technology that you have that may be much more personalized because you can actually identify the patient that's going to be a responder. And so if you think about our role as patients, we were pretty dumb as patients. We knew very little about our healthcare. We didn't actually keep our records. Only in Sweden and some of the Scandinavian countries did you have very sophisticated healthcare systems where you maintained that all in one place. We relied on doctors. We got sick. We went to the doctors. The doctors were by and large God. And we might maybe have gotten a periodic checkup. And yet the world of tomorrow is that you and I are now CEOs of our healthcare life. And we want to manage our state of wellness. That is to say, we want to prevent this state of sickness from occurring, not just wait for it to happen and then hope there's something to fix us. So as we go from sick and dying patients where reversibility is relatively low to well-informed patients where you're trying to maintain your state of wellness, the consequences of the system around us are absolutely massive. And if you're a doctor today, you're basically being fired as the doctor, and you hope to be rehired as an advisor, because we're talking about patients today who are very well informed. We can spit on my cell phone and have a little microfluidics chip up there that can do the same thing that you can do on a lab. So when you do go to that doctor today, what do? He says, Steve, how are you feeling? He pokes around a little bit, and then he draws some blood, puts it in a tube, or I pee into a bottle, or he spit onto a strip, and he sends it off to some laboratory, and 3 days later some test comes back, and he says, Steve, here's what's wrong with you. We can do that all on your smartphone today. A little microfluidics chip in there, we can spit on it, we do the calculation up in the magic computer in the sky, and we'll know on a real-time basis. So doctors then are dealing with a smart patient, not a dumb patient, a well-informed patient, and the doctors hope that using that information that is patient-specific and society-specific, they can then provide some service. We're going to live in a world of incredible amounts of data, and we're going to live in a world where we actually do make this transition. Now, you may think that I'm nuts because I spend too much time on airplanes, but this technology exists today, and so it's not that I'm out in la-la land because I'm from California. This technology exists, and the only question is how rapidly do we integrate it into the healthcare system? And when you get to integration, things like standards and interoperability and connectability become important passwords, and one of the places where regulators can begin to play a very effective role is to provide a regulatory standard that allows everybody to connect and get the benefits of that interoperability. Now, I want to talk for a second about technology because I'm a bit of a technology guru, but if you look at technology, one of the biggest changes in technology is the cost per bit of biological information. So what I didn't tell you 45 years ago was that I was involved in the start of Apple as well. And if you look at Intel and the technology that came out of the electronics world, we went from a computer the size of this building to this technology we have in our pocket in 25 years. The consequences of that are extraordinary. You have access to incredible amounts of information on a real-time basis, and you're connected with everybody all over the world. We did that in 25 years. That's the top line. If you look at cost per bit of biological information, we're moving logarithmically faster down. The consequences of getting to cost per bit of biological information logarithmically cheaper is massive. So if we can go from a computer the size of this building to this in 25 years, think of what happens to healthcare in the next few years as we move down that pathway logarithmically faster. And the consequences are things like our ability today to do sequencing. So instead of talking about it, I had my genome sequenced. And not only did I have my full genome sequenced, not a partial genome from 23andMe, but I went to Illumina, I had my full genome sequenced. I had my wife's full genome sequenced. I actually had one of my 4 sons sequenced. First thing I learned was he's really my son. That's helpful to know. But the second thing, if I just go back for a minute, I have on my iPad here, and if any of you want to do it, you can push buttons. I have everything you want to know about my genome. And so I can look at various indications that I have and find out that I've got a potential alpha-1 antitrypsin deficiency. And then I can dig down and I can say, well, let me look at it at a chromosomal level. And I push a button on my iPad, which is right behind me, and I look at all my chromosomes. And I say, well, let me look a little deeper. And so I can pull that chromosome out and I can begin to spread it out. And voila, I find that I'm fairly agreeable. That's not necessarily good for a venture capitalist who should be a bit more cynical. But if I then want to go down and dig a little further into the chromosome, I can begin to pull on that bar on the bottom and begin to pull my genome apart, and I can actually get to the individual base pairs and see what deletions are there and what's going on. Now that's all on my iPad. You can look at it after at the networking event if you want. So we have incredible technology. There's a taxonomy that basically will tell me not only what I've got, but incredible information about it. If I want to go into the diseases I have, there's information about the diseases that I have. Now you can do that for roughly $1,000 a person today, or 1,000 euros a person. You'll be able to do that in the next year or two for $100 a piece. So if you can sequence your genome, or we can sequence everybody's genome in this room, or we can sequence everybody's genome in Europe for roughly 100 euros a person, we're going to live in a world where we have incredible information that will allow us to move away from this kind of one-size-fits-all, we're all the same, to truly a world of initially personalization, and then ultimately predictability, and then ultimately prevention. And this is not something that's science fiction. This is available today and happening. And I have to tell you one other thing, and that is our genes are not our destiny. So we're not hardwired to get everything. We know a lot about societal impacts. We know that we eat too much, smoke too much, drink too much, and all those things have impact on our genome. We also know today that we have all these switches. The ENCODE study that came out a week or so ago tells us that there's 4,000 plus switches, and all of that, quote, junk DNA that we thought we didn't really understand actually means something. And so we have incredible information today that's coming off the genome and the transcriptome and the proteome and the metabolome, the connectome, and all the other omes that we're kind of throwing up into the sky, and we're going to live in a world of big data. And big data will translate into enormous opportunities. We're able to kind of crunch all that data, both scientifically at one hand and at a patient level at another, to change the world around us. So that's the world that we're going to live in. And if you think that technology isn't on a fast march, just in the last few years, we've gone from broadcast television to on-demand viewing. You've gone from PCs to tablets. You've gone from software to apps. You've gone from websites to social networks. You know that we've transformed retail stores with online retail, the Amazons of the world taking over the world. We've gone from going to the library to pushing buttons on Google. We've gone from kind of clinical testing, as I indicated, to spitting on your BlackBerry. That's all real, and that's all happened in the last few years. So don't underestimate our power as societies around the world to be innovative. There are two kinds of innovations, kind of better, faster, cheaper innovation and brave new world. Both kinds work. And so we will see incredible innovation. We have seen incredible innovation, and we're driving even more innovation. And if you just look at some of the tools we have today, high-speed, low-cost sequencing, as I just told you about, artificial intelligence, robotics, smart pills. We can put a little integrated circuit in the front of your pill. It's now been approved for Europe. You swallow your pill, you know what's going on in your body. You can check compliance. We've never been able to deal with compliance. We now have technology that can do that. We've talked here about some of the companies in gene and cell therapy. We have systemic and synthetic biology. We can take biology as a bunch of Lego blocks and begin to build whatever we want. We clearly have mobile phone apps. We have 24/7 monitors, and we're going to live in a world of very real telehealth where we can use our cell phones and others. There's 7 billion people in the world today, and 6 billion of them have smartphones. If you ask how healthcare is going to be delivered and called for in most places of the world, the smartphone is at the center of that revolution. And so as I showed you with my live core technology, you can go on the internet and see this It's fabulous technology. It's here today, it's approved, and it's coming into the market very fast. And all of this technology is going to improve access, reduce costs, increase compliance, personalize treatment, allow for earlier interventions. And it's a part of our world. This is not a separate world out there in La La Land. This is the world that we live in today in the healthcare world. Now, despite all of this innovation, we've got to deal with where does the capital come from. And the good news is that there is capital available. Now, you may argue with me, I just raised $1 billion, so we have a lot of capital today. Parenthetically, I haven't told anybody about that, so for the press, I just assume you don't put out a press release on it. But I'm pretty popular today because we have $1 billion to invest. I'll be a little less popular in a few months when people realize that we say no to 99 out of 100 deals that we see. Now, for the entrepreneurs in the audience, that means what? It means you're going to be tenacious as hell. If I say no to 99 out of 100 deals, you have to find the 1 out of 100 that are going to do that. Most European entrepreneurs go talk to a few VCs in their country or a few VCs in the region, or they go to the EIF and they say, you know, there's no money in Europe. 100. You have to kiss 100 frogs. So I encourage you to understand that the really successful entrepreneurs in this community and elsewhere are tenacious people who won't take no as an answer and keep charging around. Interestingly enough, if you look at the various European governments, there's actually a fair amount of capital available. There's lots of differences country to country, and most people try and finance in their country and conclude if there isn't capital in their country, there's no capital. I can tell you I'm totally agnostic to geography. I spend probably a week, a month in Europe. We've invested in a number of companies in Europe. I don't care where you are on the globe. If you've got good technology that we think can solve a real problem, we'll invest in it. So no really good company should ever fail because of lack of capital. The problem we have is that we don't often know the difference between a science experiment and a good company. And that's a big difference, and we have to understand that. If you look across Europe, you see a fair amount of country variability. The biggest problem we have in Europe with capital is the exit vehicles. Why don't I invest? Because I'm not sure how I'm going to get out. So the only way I can get out is a trade sale. It's not as attractive as robust equity markets. And people forget in Europe frequently that the important role NASDAQ and others have played in the United States to provide a vehicle for early stage investors to get out so that others investors can come in. I think the other thing we have to recognize is that particularly around the world today, angels are playing as big a role in financing this industry as are the professional investors. So this is a rich aunt or uncle. This is somebody who's passionate about it, who's made some money in some other areas. There's as much angel capital coming in today as there is venture capital. And secondly, when you look at venture capital, it no longer is the vehicle by which you finance your company and you go public. Today, there's a lot of government activity. You see that here in Europe. Many of you have talked about how you've gotten support from governments and development authorities. There's angel capital. There's increased amounts of capital available from celebrity organizations and disease advocacy organizations that are changing the nature of the way we build companies. So we don't do it like we did 25 or 35 years ago. You have to be as creative in financing your company as you are in building your company. And we, Burrill, just raised money from the Russians, we raised money from the Chinese, we raised money from the Brazilians, we raised money from the Taiwanese. I ran all over the world and raised money because the traditional sources of money for people like us, the pension funds and the institutional investors, are not in that business. And so you too need to run around the world and look for sources of capital. If you look at the disease advocacy organizations, they're playing a critical role today in providing capital to technology that's going to solve their problem. And so patient groups have grouped together, put capital together and said, we will put that capital into the people that are going to solve our problems. So these people have become major funders of relatively early stage organizations. The second thing we've done around the world is we've built not only incubators, where you companyize every technology, but we built accelerators, where you don't companyize technology until it's later. And so the forms of business growth today are quite different than they have been historically. And I would only end my comments about capital by saying there's plenty of capital in the world to do what you want to do. It's clearly more expensive. It's clearly inefficient to get but no good company should fail because they couldn't get capital. These entrepreneurs here that are being honored today are tenacious sons of guns who've gotten the capital necessary to pursue their dreams. We know it can happen. It just takes a different personality to go and get it. I want to touch on the non-healthcare world because in Europe, we've seen a transformation of the views of the European people about biotechnology, largely because of the energy crisis. And because of the energy crisis, Europe has said, you know, we don't have to continue to be beholden to those guys in the Middle East. We can use our own resources to generate sustainable energy. As you know, EuropaBio is doing a big thing in Dusseldorf coming up on this. We're looking at biotechnology to provide the security in the food supply. We're looking at biotechnology to solve the problems of clean water. And as many of you heard in the earlier discussions, we're using biotechnology to actually get at industrial productions, biobutanol and other things like that. So biotechnology has clearly moved away from being kind of very much devoted to its healthcare outcomes to today addressing a very different set of problems with dynamic market opportunities where governments and societies around the world have said we're not going to just be beholden to Middle East oil, we're going to build sustainability. That has, in countries and areas around the world, created some debate I don't want to get into about food versus fuel. There's plenty of agriculture to do both. It hasn't really led to changing food prices. The drought in America has probably led to changing food prices more than technology has. The demand for biofuels, no matter what statistics you see, are massive. This isn't a function of a few government bureaucrats saying we want to buy more of this stuff. The absolute demand for biofuel sustainable energy is going right off the top. And we're players in that. We're important players, as you heard from some of the companies here today. We do have plenty of technology that can improve the food supply and make it safer. Interesting that the Europeans, who were by and large a little anti-GMO 15 or 20 years ago, have now kind of said, you know, maybe that stuff isn't so bad. Maybe it makes our agriculture more productive. We're putting more output traits, not just input traits, that is nutritional value and other things. We're dealing with a very complex set of issues. I'll let you sort it out. But it's fair to say that technology provides better food, better fuel, and is transforming agriculture and the use of agriculture in the world around us. You see that all across. Politics still a big issue, more so in Europe than in the United States, although we're dealing in California with a labeling issue right now, which is going to be pretty messy. And by and large, we're going to end up with labeling whether we like it or not. And that will have some negative consequences on us. Let me just close with a few summary comments for all of you, things to think about. First thing to think about is the pharmaceutical industry as we know it today are the dinosaurs of today. The question is, can they change their business model fast enough to survive? And they're by and large becoming marketing and distribution companies. They're outsourcing innovation. I was chairman of Pharmaset. We sold that company for $11 billion, 4 years before the first nickel of revenue. 4 years before the first nickel of revenue, $11 billion. Tell me that value is a derivative of sales and EBITDA. There are no sales, there's no EBITDA. We sold that company for $11 billion. We are in the value creation business, and we're creating incredible value. And our friends in pharmaceuticals understand that, and so they're buying us at big-time prices, and that's good. And so they're moving from being a vertically integrated industry to being a virtually integrated industry where their job is to take innovation to the markets that they are in very, very fast. They look more like Walmart than they did like the Mercks and Pfizers and Lillys of the past. Secondly, value will be our driver. We have to create value. Don't simplistically think about value. Value is very complex. One little story about value, think about Google, 10 years old. Think about Facebook, 7 years old. Think about Twitter, 5 years old. Household names. You use those technologies every day. You never pay for them. Never pay for them. Value is created outside of the product, not in the product. They give the product away, they derive value outside of that. A foreign concept to our industry. We're going to learn how to create value and capture value in a way that may in fact be outside of the product. The thought that you'd give your drug away because you can get informatics on the patients is interesting. If you look at the grocery stores of today, the grocery stores make all their money on the information they provide to the consumer product companies, not on the margin from selling it. So value is not an easy concept to understand. Thirdly, understand that the doctors who historically were God are going to be replaced by the payers and the patients. God will change in that context. The world has largely been divided into three. You have the US, Europe, and Japan. It's largely been a third, a third, a third of the world. It's now less than 50%. Most of the growth in our economic world is outside those three countries. We're not prepared for that. We don't know how to do business in China. We don't know how to do business in Russia. We don't know how to do business in Brazil. And yet they're going to consume more than 55% of the products in our industry, moving away from the triad that has historically made us strong. Understand the changes in the financing path. It's not like it was when we were growing up. Look at the role of regulators. The FDA was historically the gold. It was the gold market. If you really got technology approved, you got it approved in the US. I would argue that the FDA is going to be a late adapter. When I finance technology around the world, I'll take it to any market in the world. I can take it in and get patient experience before I take it to the FDA. So interestingly enough, Europe may be an early adapter of much of this technology, not a late adapter. And so don't look at the FDA as being the goalpost for all of you. Look at regulatory systems around the world where you can get access to patients and access to payers and improve healthcare. And it may be that you come into the US late. Healthcare was a function of place. It's no longer a function of place. You'll look at the Mayo Clinic today. The Mayo Clinic is building clinics in the malls of America. They're taking healthcare out. Walgreens in the United States expects to account for 30% of the healthcare cost. That is disintermediating the family doctor. You'll go to Walgreens, you'll go to Walmart, you'll go to a different payer for principal parts of your healthcare. Again, this is technology that's real today. And so technology is being changed because we have things available at a patient level and at a doctor level. We've mechanized the world. We no longer have basically your records maintained someplace else. They're all going to be in the cloud, and we can derive extraordinary value out of that. Be prepared for that world. Don't worry about privacy. My European friends say, "Oh, Steve, we're going to have privacy." I will tell you, nobody cares about what's in my genome. If we can take my genome and put it in the cloud and everybody else's genome, and we can derive some value out of that, praise the Lord, that's good. Nobody really cares about what's in my thing. So privacy is not really real. And secondly, those same people that worry about privacy go home at night and they spill their guts on Facebook to people they don't even know. So privacy is kind of a funny issue. We kind of talk about it, but it's not real today. The transformation around agriculture is very, very real. As I mentioned, it's going through the same phenomena we had. A couple of final things. Governments, whether you like it or not, are going to institute whatever they can to reduce costs and improve outcomes. You've got to be in the value business to do that. They're going to find a way to penalize unhealthy behavior and reward healthy behavior. A patient who stays well longer will be good for the healthcare system. And whether we're charging fat people on airplanes a higher price because there's more weight, or whether we charge diabetics or smokers or whatever, we're going to see governments around the world penalize unhealthy behavior, more importantly, reward the maintenance of health. Remember, the payers are big players in the system. Capital available will be different. New sources of funding are very real. Value, as I indicated, is something you have to understand. Emerging markets are enormously powerful. Synthetic biology is with us. It is to say we can put biology together and create different things. That's not bad. I would argue this is our industry's greatest moment. We have more opportunity today than we've ever had. We have to understand that the marketplace is different. We have to understand that we are building products for tomorrow's market, not today. If each one of you guys said, when is my product going to be in the market? It's going to be in the market in 3, 4, 5, 6, 7, 8 years from now. Don't assume that market is anything like it is today. So you may not like my vision of the future, but you ought to have a vision of the future because your companies and your products are going to be in a different marketplace in 3 or 4 years than we have today. And so our industry, where we understood today the true molecular basis of life, is at its greatest moment. And I just encourage you to be creative and to build fabulous companies. Thank you very much.